Please note, the Council for Responsible Nutrition, CRN, does not endorse any guest appearing on this podcast or any products or services they may discuss. The views and opinions expressed by guests are their own and do not necessarily reflect the views or positions of CRN. Thank you and enjoy the episode.
You are listening to Supplement Source, the official podcast of the Council for Responsible Nutrition. And now your host, Jeff Ventura.
Hello, and thank you for listening to Supplement Source. My name is Jeff Ventura. I am the Vice President of Communications here at the Council for Responsible Nutrition. It is absolutely my delight to announce that I have in our studio today Doug Lynch, who is the CEO of MarketWell Nutrition. Doug, thank you so much for joining.
Jeff, thank you very much for the invitation, and I am delighted as well to be here.
We are going to cover, I think, a wide range of topics, and I'm excited to speak to somebody who has such a vast sort of handle on the industry. Normally when I have guests on the show, we're speaking about something very specific. I thought we would start by talking about I'm calling it the race to quality, which is this notion that there seems to be quite an emphasis, and some of it being, I think, consumer focused on distinguishing between quality brands in the marketplace and we'll just say brands that may not be adhering to the same standard. And we know that there are third-party verification sites that are popping up that hold or that at least convey the promise to the consumer that they'll help separate the wheat from the chaff and really help people understand what are some of the more efficacious and viable products on the market.
Right.
What's happening, Doug, in your assessment?
Yeah, right. Well, I think we all can agree that the race to quality is a race that we all win when that happens consistently. There's questions that consumers have fairly or unfairly about that trust is sometimes easy to lose and not easily made. And so the intention through certifications and through various ways to communicate that this product is what it is, says what it does, and the consumer can buy with confidence. These are all very, very good things. And far be it from me to say that this is a bad trend. I think we can kind of, from my perspective, these developments are helpful. There are developments that have been helpful regarding certifications back from the ISO days to the USPs, the NSFs. These are certifications that companies have made to make sure that their products are GMP. Because again, in the end, we're all kind of having that same kind of process. We're all kind of saying, how do we make a product better? How does the consumer ultimately win, and how do we gain their trust? So these certification procedures during the production and manufacturing I think are extremely valuable. Post-market, products into delivery systems, I think they're helpful, but how much helpful is really the question, because inevitably I know that there are things that will make a sample of a larger batch of something potentially not check out. The smaller you're taking your little spoon into the mix or the blend, there is some variability here. I don't think necessarily once it's in a finished delivery system that you're taking into account supply chain. They're from one producer to the other that might have seasonality, particularly if you're looking at botanical ingredients that might, in a very small flashpoint or small picture of a much larger photograph, a small portion of it, are we really seeing what's really there? And this is where we come down to some of these questions. I mean, for example, ultimately, if I put one single ingredient into a finished product to look to see if that finished ingredient is in there, has a certain set of rules and a certain accuracy, right? But once I start putting 9 or 10 or a multivitamin with your 45 ingredients in there, how do we know that there's not some type of matrix interference that's taking place? How are we accounting that difference between the other raw materials that might be hiding analytically what's in there? Heck, when everybody loves gummies, for example. People are saying it's a great delivery system. Well, even the matrix that it's in, once you cook it and you put it into the pectin or the gelatin, how do you separate that from the active ingredient? These are really tricky questions. And when you say that you're sending it to a laboratory, here's the last bit of questions I have. I have questions. I'm not saying I have all the answers, but I have questions. The question is, once you send it to that laboratory, they might be the most certified, qualified lab in the world, but they're only as good as the person that's running that test. And so I can tell you in the real world, because I'm responsible for not only ingredients and market trends, but also I have some products that are on the medical food side, for example, that I do. Well, we wanted to test a methodology. So we sent to a very well-known lab that does this, that I would say, hey, you're in this industry, pick a lab out of thin air. And I'm going to say it's going to be one of the three that you picked out in thin air. We sent 5 of the same batch samples to that lab, and we got 5 different results. So, at a certain point when somebody says, I have a lab report saying you're not in there, and then I take my product and send it to another lab and say it is in there, how do those things get resolved? These are really tough questions. So I come back to the point that I'm not necessarily against the concept of third-party post-market validation. I'm just saying there are some tricks to this that haven't told me that they have all the answers to it.
Right. And we've gone through, CRN has gone through challenging a lot of this testing methodology to some success that you're touching on there. So it's interesting to kind of also include that as yet another layer of complexity on whether or not these companies that are coming into this space and doing their own testing of other companies really are approaching that in a way that responsibly reflects all that goes into that process. So
sure.
It's fascinating to think about.
Sure. I mean, again, if you look at a manufacturing environment where you're not talking about making 100 capsules, but you're making a batch with 75 to 100 kilograms of multiple powders being put into a blend, or let's multiply that by 10, because that also happens, right? When you're in production, in order to get those certifications, you have to have procedures that are taking place to make sure things don't grow, that the homogenization is working correctly. And anyone that's seen this knows there's a bell curve associated with this. And so you hope in the bell curve that when you're at fully manufacturing, from the machines get turned on to the point where they turn off, that you actually are getting everything out of that blend. Well, there is still that part of the bell curve that wound up in a capsule somewhere.
Right.
All right. And will you identify that little piece of it? And this is where it gets tricky, but you want to make sure that we try to address these through GMPs. We try to address these through claims that people can feel, see, and do biomarkers for. Because in the end analysis, if the product works, if the product is quality and it's doing what it says, that product's going to be sold over and over again. And so the market will dictate which of these post-market evaluations are what the consumers are really asking for. The market will dictate whether these supplements are made of sufficient quality that people will take them for the long haul, that the brands inspire trust. The market will ultimately dictate those things. And yes, I can totally understand and appreciate a company that does it right, that does all the certifications, that sits there and makes sure that they test their product before, during, and after they're finished with it, that a company can come up and do none of that work and shove it in a capsule and make a claim. So I'm very sympathetic to the companies that want to do this correctly.
Yeah, well, you're preaching to the choir on that one. So hey, let's switch gears for just a second. Let's talk about your clients and what some of the folks that you interact with in the industry worry about. Are there some issues that have people, I don't want to say it's dramatic to say, keeping them up at night, but that have come up again consistently over and over as things that maybe define some of the challenges that the industry as a collective are facing.
Yeah, sure. I mean, look, when you invest in your product and you invest in clinical trials, this is a lot of capital that you're putting forward. You need to make sure that if you're going to invest in these studies, that you get results out of them that ultimately justify the outlay and the risks that you've taken. So it's important that you design the trials correctly, but in the end analysis, you come to a point where it comes down to a structure function claim that you've either demonstrated or not. And many times these structure function claims are very, very vague. And they're easy to put on a bottle and very difficult to make sure after the fact. So it kind of comes back to our discussion, how much real science went into that product by you or your competitor. And it's really painful when it's you that put all of that work into it and a competitor goes in and does otherwise. Now, again, in my position, I always start from the perspective with my clients that there should be something that's very unique about your product and differentiated from the get-go. Because you don't want to do all this education and spend this resources to have your competitor just use your education against yourself, right?
Rip you off, essentially.
Right. I mean, you do all the work and they get all the benefit of that. So there is the pursuit of intellectual property in these formulations is something that I take very, very seriously, and my clients do as well. If there's no IP in the active ingredients or the finished formulation, and many of that comes from the ingredients themselves. If there's no IP from it, I rarely get involved with it because in the end analysis, you can't maintain a premium price point that actually is long enough to survive very quick trends. This industry, trends come and they go. The year of CBD, for example, right?
Oh, yeah.
Everything said it. It was everywhere. It was a huge trend, and then it disappeared as fast as it got there for many reasons, which we won't waste your time here.
Separate show, yeah.
But a separate show. Separate series probably on the colossal failures there. But the idea here is you can formulate a product based on very strong ingredients that have great claims, that have IP built in, and I don't just mean manufacturing patents, but I mean composition of matter patents and use claims that are very, very strong and unique, that ultimately in the end help you develop a product that will validate the structure function claim and make the investment back, that you didn't sleep at night thinking about the $500,000 to $1 million you just spent on a clinical trial. I think there's some questions about AI right now in terms of how to harness it and how not to be destroyed by it. AI is changing the landscape dramatically.
Specifically, what's the sort of top of mind discussion about AI among your client base?
Sure. I mean, it depends on if you're an ingredient supplier or if you're a finished product. You're deploying the AI in multiple ways now that would have considered to be fantasy years ago. For example, AI is being used in the supply chain when you pick the property, when you pick the farm to grow your botanical. You're using drones that are flying over to and soil samples to test for pesticides and the like that ultimately could take years to get out of the farm. So you're using AI to pick a better location for a faster renewable resource. And then now we're using AI to discover activity between active ingredients. So we're able to use machine learning to know that if this particular extract does the following things, what 99 other things could it likely also be doing that we need to at least account for, if not be able to use ourselves, know that our competitors might use the same way to find how these things are going. So you have AI in discovery of active ingredients now. Now you have AI that's actually going into, now you did discover it and you want to do a clinical trial and you want to actually make sure that investment pans out, like I mentioned before. Well, what are the common denominators for the people that are in this clinical trial? You know, when you're talking about an N number of 30 people in the trial, or are you talking about an N number or population of 30,000? Because you're using AI to actually tap into other studies that are being done, de-risking that platform.
Yeah. Right.
So AI is there.
Meta-analysis. Yeah.
Yeah. And then ultimately AI is being used to understand consumer trends, wants, needs, that ultimately we're able to now tap into IRI data and spins, IRI, and thousands of studies that are out there and surveys of people in industry and consumers alike, metadata, using that for metadata to be able to understand what the consumer is looking for.
We heard people for so long say big data, and I don't think anybody knew what it meant. It was like a trendy thing to say. And now you really do understand that what big data was all about, because you can actually process the data in ways that lower cost of entry, right? So you have much smaller players innovating in a much bigger way, I think. And I think that's probably
absolutely
a trend, right?
Absolutely. And then again, the consumer is been given the keys to some of this through their chat GPTs and their perplexities and the like. The consumer is now, it used to be Dr. Google, I say it's Dr. AI. So the consumer is actually typing in, I have a heart condition. What are the active ingredients I need to be taking for this?
Right.
Google used to sell itself to the people that were bidding for those spaces on the top of page. But now you've got any chat bot that can give some information, but I know this, that AI hallucinates, and AI can cram 100 different active ingredients and call it one. And so the consumer has to be sharper of what they're looking for, and how we as manufacturers, how we as brand marketers are being able to utilize this is nothing short of revolutionary, and companies will either be made by this or rendered pointless by this.
Yeah. Last question as we kind of wrap up. I wanted to talk to you a little bit about the horizon. So we're talking about AI as sort of, obviously everyone is talking about AI as the next big thing. What else in terms of VMS marketplace do you think may be in store for us around the corner? What is it is there a trend that you see as emergent?
I say the word longevity. People have heard it a lot this year and maybe a year prior, but yeah, I've been kind of saying it for a lot longer than that. Ultimately, our ability to live healthier lives is worth it if we live longer lives, but also live longer lives healthy. So those trends of health span being a dominating conversation versus lifespan and are going to continue. I see.
Well, and Doug, to your point, I mean, there was an announcement today out of Nature. Daily multivitamin slows the ticking of the epigenetic clock. It's making all kinds of headlines.
And that's great to see that our multivitamin, our friendly multivitamin has come back in the news, because sometimes when a multivitamin doesn't do everything, there's a headline associated with it implying that it does nothing. But then the question is, like, which epigenetic clock are we talking about here? Which one is validated? Which one is not? There are 12 hallmarks of aging. And so the reason why I think that supplements are very unique set up to address these issues is because drugs typically are one marker, one mechanism of action, and the two meet together to have a desired effect. Well, aging is not like that. Aging is not a disease, but it is the mother of all diseases, and ultimately it is affected on multiple ways. So I think that there will continue to be cocktails that come up of nutritional dietary supplements that actually will address these things. The lines between disease, what is a disease, and what is a supplement have always been blurry. You will always have the pharmaceutical industry trying to reach and encroach, and you always have the supplement industry try to push back effectively. I do think that our friendly medical food is going to come back. I'm banking on it, and I also think that it gives you the strongest claims. Obviously, there are things that you have to have in order to qualify for a medical food, so you can't skip those things. But inevitably, I think we're going to have a much better health span and lifespan if we can give people the right nutrition before they get sick.
My cocktail to stave off aging is a gin gimlet.
Yeah. Well, I'd like to see the study, sir. Call me suspicious. I can also appreciate the wisdom in that. So thank you.
Doug Lynch, it's been a sincere pleasure having you on the show. You are welcome back anytime. We really appreciate it. Doug is from MarketWell Nutrition. He's their CEO.
Thanks, Jeff, and thanks, CRN. Really appreciate the chance to talk today.